care.
You would do that suction, you would clean up your suction mess, and then you would go and do your trach care. Some facilities, it's all in the same kit. Like the ones you guys have in your bags probably have the suction catheter in here so that you can suction and clean all at the same time. The other thing you guys are gonna come across is disposable inner cannulas. If you had a disposable inner cannula, you're gonna put on a regular pair of gloves. You're gonna pop this inner cannula out. You're gonna throw it away. You're gonna have the new sterile one open. You're gonna pick it up by just this piece, because this piece doesn't need to stay sterile. And you're gonna come pop the new inner cannula in. That's an inner cannula change. That's most of what you're probably gonna do in real life. But you're still gonna have some patients whose insurance doesn't cover inner cannulas, or they're just really expensive, and so they're still gonna do the true inner cannula, pop it out, clean it, and put it back in. So that's what I'm gonna show you. Come a little bit. Because your gloves are gonna be on top, and you need to pour your solution. So you wanna kind of shake them so the gloves get out of the way. Additional supplies you're gonna need besides your normal saline is you need some hydrogen peroxide per facility policy. Some of them don't use it anymore. And then a new set of trach ties. Okay. Alright, so I'm gonna open my sterile kit. Okay. You're gonna do one container, half peroxide, half saline. The other container is going to be all saline. So you can decide which one you want to pour first. So I'm going to look at my hydrogen peroxide. New bottle, never been opened, not expired. Technically it's expired. Date, time, and initial. And I'm going to pour half hydrogen peroxide. Now, I opened this bottle to do suction, so it's now no longer a new bottle. So what I have to do is I have to lip it to rinse the edge of anything that might be there. Okay. So I'm going to fill the other half. And then I'm going to switch hands. Okay. Uh-oh. That's bad. Pretend that there is saline in that other one. Just check your kits before you go pouring solutions. Alright. Okay. So I've got saline hydrogen peroxide, saline on this side. Okay. Just making sure before I put my sterile gloves on that I've got everything fine. Alright. Big trick is always where's the thumb. Okay. My sterile drape. Now, when you go to take the rest of the stuff out of the kit, reach in, grab all of it, and pull it out. And I'm going to show you why. Because this is what's going to happen. If you try and pull your stuff out of your sterile kit by pulling this, everything's going to flop and it's going to lose your sterile. So pull everything out. Brush. You'll have 2 Q-tips, 2 pipe cleaners. Just fine together. These are old trach ties. You can just throw those away because you don't want to use those. Okay. Now you have one piece that's what we call split gauze that goes up under the faceplate. Make sure you sit this somewhere so you don't accidentally use it. And then you should have a couple pieces of just regular gauze. 4. Okay. Now, the inner cannula cleaning is sterile. The stoma cleaning is not. You want to keep it as clean as possible, but it's not going to be sterile because once you get up under that faceplate, you're no longer going to be sterile. But I want to set up my stoma cleaning supplies before I dip that inner cannula into my hydrogen peroxide, and now I have sputum floating in it. So I'm going to take one Q-tip in each, so hydrogen peroxide saline, just saline. And I want to do the same thing with a piece of gauze. So I'm going to dip it in the hydrogen peroxide saline, and I'm going to dip the other one in the saline. Okay. All right, now I'm ready. Pick a hand and contaminate it. Again, I'm going to keep my dominant hand sterile so I can deal with my sterile supplies, and I'm going to contaminate this hand. I'm going to take my inner cannula out, again just touching that outer portion. Okay. Now, depending on how nasty this is, you can dip it or you can soak it. Most of the time, if you did a good suction, you should be able to kind of dip it. But if not, or you have that patient that's just full of secretions, so I'm going to dip it in. I'm going to rock it back and forth. Okay. Then I'm going to take my brush. I'm going to dip it just because it makes it easier. You can go from either end. The problem is going from the top, you run the risk of contaminating the brush. It's hard to get it to go in the bottom is the problem. Okay, well, from the top. Okay. Stand back from your sterile field because you don't want to go flinging this all over your sterile field. In practice, when you're done with the brush, put it on your table because you're going to repack these kits to practice with. But in real life, just pitch it. Because we don't put hydrogen peroxide back into the patient's body, we're going to go into the saline, rinse, 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 rinse. You may want to rinse it 2 or 3 times. Okay. Then I need to dry the inside. So I'm going to grab my pipe cleaners, feed them in. Back and forth, dry the inside, throw them in the garbage. Okay, everything's ready. Put this back in. Make sure it clips. And now I no longer have to be sterile. But think about it. This hand is gross. This hand is still sterile. So do anything you still need to do that is like gross with this hand. So I'm going to take this off. Pull out the old disgusting drain sponge because it's going to be nasty. Hydrogen peroxide. Half moon underneath the faceplate. You want to get down around the edges of that stoma with the hydrogen peroxide and throw that in the garbage. Now, there's a huge debate about which way to do this. As long as you rinse with saline when you're done with hydrogen peroxide, it really doesn't make a huge difference. I do all my hydrogen peroxide first. So now I'm going to go further out around the skin, making sure that I clean up the faceplate because this is probably going to have some secretions on it as well. So I'm going to clean all that up. That goes in the garbage. Now I'm going to come back with my saline. So I'm going to take my saline Q-tip, making sure I'm rinsing all the hydrogen peroxide off. Garbage. My saline gauze, same idea. Okay. And last but not least, I just need to dry it. So I'm going to dry the skin down on the bottom, dry off the faceplate. Okay. So the care part, other than putting the drain sponge back on, is done. Now, you guys can decide, do you want to change trach ties first, or do you want to put the drain sponge back on first? I changed my trach ties first, because the Velcro of the trach tie gets stuck to the drain sponge. So, like we talked about in class, in order to prevent decannulation, I don't want to take the old trach ties off until I've got the new ones on. Now, if the old ones are disgusting, what you may want to do is get a second set of hands to help you so you can take the old ones off and someone can hold the faceplate so that it doesn't pop out, because you don't want the two to come in contact. But if they're not that horrible, and we're going to say for CPEs they're not, what I do is I usually scoot my old ones to the bottom, and then I'm going to get my new ones. And if your hand is really gross, change gloves. Okay. And it's just a little piece of Velcro. So I'm going to attach that side. And I'm going to attach this side. Now people will be like, can I take my gloves off for this? No. You didn't want to do that. Now once you get it there, the attachment, the adjustment is back here further. So I'm going to tighten it up. The new ones are on, so I'm going to take the old one off. This would go in the garbage, but keep them for practice. Okay, now V goes up to catch all the secretions. You want to try and get this all nice and smoothed out because you don't want it to cause any skin breakdown. You're probably going to change this a little more frequently than you're doing full trach care. Okay? Alrighty. That back up. Take my gloves off. I will clean up my mess. Put his pillow back behind his head. Getting back into a position that is comfortable. Make sure he's got his call light. His bed's in the lowest position. Okay? That's trach.
Documents.